Welcome to Chapter 17 lecture. In this lecture we're going to be discussing muscles of the head and neck. As with other muscle chapters, there's only 6 muscles you need to remember the origin insertion for. These are the Scalenes, Sternocleidomastoid, Temporalis, Masseter, Orbicularis oculi, and Orbicularis oris. You need to know the names and one action for all the rest of the muscles. Know the synergists and antagonists for each muscular movement, and you don't need to know any of the innervations. First 2 muscles we're going to talk about are Occipitalis and Frontalis. Occipitalis is a large muscle found on the occipital region, and its action is to draw the scalp posteriorly. The Frontalis muscle is found on the frontal bone, and its action is to raise the eyebrows and draw the scalp anteriorly. Typically you might see this muscle listed as occipitofrontalis because it's connected with this broad aponeurosis called the galea. Next muscle is the Corrugator Supercilii. The function of this muscle is to adduct the eyebrows, so it pulls the eyebrows medially to create a mean face. Orbicularis oculi. Its origin is the frontal and maxilla bones, the margin of the orbit, and it inserts onto the skin of the eyelid, and its action is to close the eyelid. There are 4 muscles of mastication. Mastication is the process of mechanically breaking down food, chewing. So there's 4 muscles that originate on the skull and insert into the mandible. The temporalis and the masseter muscle are used to elevate the mandible, chomp down, bite, while the medial and lateral pterygoid muscles help to elevate and produce this grinding motion with the molars in order to break down the food. So you can see in the pictures to the right, the temporalis muscle, large muscle that sits along the temporal region. Masseter muscle attaches to the angle of the mandible and the zygomatic bone. And then in the lower picture you can see an medial mid-sagittal view looking laterally towards the outside. You can see the lateral pterygoid and the medial pterygoid muscles. The temporalis muscle originates in the temporal fossa. It inserts onto the coronoid process of the mandible, and its action is to close the mandible. This is the muscle that if you bite down you can feel in your temporal region bulging out. Your masseter muscle originates on the zygomatic arch, inserts onto the mandible, and its action is to close the mandible. This is the muscle in your lower part of your jaw that if you squeeze your jaws together you can feel it bulge out on the sides. Pound for pound, this muscle has been measured to be one of the strongest muscles in the human body due to the amount of force that it can propagate into your mandible. Zygomaticus major and Zygomaticus minor. Their actions are to draw the corners of the mouth posteriorly and superiorly, as in to create a smiling effect. Risorius. The action of Risorius is to abduct the corners of the mouth, so it draws the edges of the mouth laterally, so to create a pursed lips effect. And Buccinator, its action is to compress the cheeks. This is a deep muscle, it's deep to Risorius. Mentalis is a set of paired muscles that sit in the mental region, and their action is to protrude the lower lip into a pouty face. Orbicularis oris originates on the fascia of the facial muscles, inserts onto the skin of the lips, and its action is to close the lips. Depressor Labii inferioris. The name of the muscle tells you what it does, so it depresses the lower lip. And then Levator Superioris, again, it tells you what it does. It elevates the upper lip and it flares the nostrils. You can't elevate your upper lip without flaring your nostrils. If you try and do it, your nostrils flare automatically. The scalene muscles is a set of 3 muscles. You don't have to be able to identify anterior, middle, or posterior. You just need to be able to know them as the scalene muscles themselves. So they originate at C2 through C7 along the transverse processes of the cervical vertebrae. Inserts onto ribs 1 and 2, and their actions are to elevate ribs 1 and 2, as well as flex and rotate the neck. Levator Scapulae. The name tells you what it does, so it elevates the scapula, abducts the neck, and rotates the neck. This is what makes us shrug, or this is a muscle that we contract to create this shrug look. Sternocleidomastoid, named for where it originates and where it inserts. So, it originates on the sternum and clavicle, inserts onto the mastoid process of the temporal bone, and its action is to abduct the head, rotate the head, and flex the head. Pretty much head bang like these guys on their way to Roxbury. Sternohyoid, its action is to depress the hyoid bone. It tells you what it's attached to, the sternum and the hyoid. There's sternothyroid, and its action is to depress the thyroid cartilage. You have the digastric muscle, whose action is to open the jaw when the masseter and temporalis muscle are relaxed. The omohyoid, which depresses the hyoid bone, and the platysma. This is a very thin muscle, and its action is to depress the lower lip and open the jaw as well. In order to understand some of the names of these muscles, you should really know your roots. So, scalenes, this is just a triangle with unequal sides. Sternocleidomastoid, as I mentioned, was named for the origin and the insertion. Masseter is Greek for one who chews. Orbicularis oculi means circular eye, and Orbicularis oris means circular mouth. So, circular muscles that go around the eye and go around the mouth. This is the end of the muscles of the head and neck. Remember, you need to know the name, origin, and insertion for the following 6 muscles. And you need to know the names and one action for the rest of the muscles listed in Table 17.1, as well as which muscles are synergists and antagonists for all muscular movement about the head and neck. Thank you very much, and you have yourself a good day.